Good afternoon, everybody. My name is Genao, and today I'm going to be doing an instructional video on um, horizontal gaze nystagmus test. And the horizontal gaze nystagmus test is a test that's been used for a pretty long time now. It's one of the standardized field sobriety tests, batteries that we do in law enforcement to be able to determine if somebody is impaired under alcohol or some type of other drug that has an impairing effect. And it's one of the most reliable tests that law enforcement officers can do. The reason being is because most people can't disguise their physiological symptoms um, when you do these tests. And when you do the horizontal gaze nystagmus test, people can't disguise it, they can't hide it, so it's easy for somebody to see. And first, we need to understand what nystagmus is. And nystagmus is what you call the involuntary jerking of the eyes, and from when gazing from side to side. So what an officer would do is technically you would take your finger and you would place it 12 to 15 inches from the bridge of somebody's nose, and you would ask them to focus on the tip of your finger. And when you do that, the person readjusts their focus. You'll see a change in pupil size, and that gives you the indication the person is actually focusing on your finger. Then you would go from side to side and check first. You would check for equal pupil sizes to make sure that there are no underlying injuries like brain trauma that could affect the test, some kind of birth defect, or blindness in any eye. Then you would see resting nystagmus, see if somebody is actually, some people are actually born with nystagmus. So you would check and make sure that the person doesn't already have that. And then you would check for equal tracking. And what equal tracking does is make sure that both eyes can track or can follow your finger equally at the same time, that one eye doesn't gaze off and another one continues on smoothly. Then what you would do is you would check for lack of smooth pursuit. And to define lack of smooth pursuit, it's pretty much if you can picture anybody who's driven a vehicle and has water that hits your windshield, and you put your windshield wipers on, the windshield wipers, they glide across the windshield smoothly because there's water on them. Well, a lack of that would be pretty much if you had sand on your windshield and your windshield wipers would kind of stutter a little bit when they go across the windshield. That's what you would see in somebody's eyes when they were tracking. Their eyes would kind of stop at different intervals because they can't track smoothly across. And you would start from the left eye, then work your way to the right eye. And then after lack of smooth pursuit, what you would check for is a distinct and sustained nystagmus at maximum deviation. Now, maximum deviation is pretty much when you go all the way to the side and the person can no longer look at your finger, or they're looking at the maximum amount that their eyes can possibly turn. You would start with the left side, then work your way to the right side. And you would hold it there for a minimum of 4 seconds. Then what you would do is you would go to the right side, and then you would do that for a minimum of 4 seconds. And then again, you would do a second pass to the left side for a minimum of 4 seconds and go again back to your right side for a minimum of 4 seconds. Then you would check for this onset nystagmus prior to 45 degrees. And what this is, you're going to, of course, you come out 12 to 15 inches. So if you go out 12 to 15 inches, that's a 45-degree angle. So you would hold your finger at about a 45-degree angle, and you would hold it the whole time. You would go out slowly from checking the left eye first and then the right eye. You will hold it slowly to see if you see some kind of nystagmus as you go prior to that 45 degrees on both sides. And you would do that again, and you would do it for a minimum of 4 seconds, and you would go from left to right and left to right again. So you would check it twice. You always check it twice. And finally, you would do a vertical gaze nystagmus test, which is up and down, 12 to 15 inches. You would go all the way up until the person can no longer look up anymore. They're at the maximum point. And then you would check if they have nystagmus at that angle. If they do present nystagmus at that angle, that indicates that that's a high dosage for that particular individual. Doesn't mean that that anybody else, different people have different dosage types, but for that individual, it's a high dosage. So hopefully this has been informative for you and kind of understand a little bit of what the horizontal gaze nystagmus test is. Thank you.